Now, let's hand over to Roland Walker, who is going to introduce an interview to us.
So we went to the plush office of the Deputy Minister for Health, Dr. Okoe Boye, and we had a number of points to be the premise on which we asked some great questions. Ghana's COVID-19 rising case count, and how government is making the effort to make sure that we hold the spread. Just take a watch.
Interventions we put in place to see still some level of cases, because most of the interventions you put in place or countries put in place are supposed to reduce the transmission rate of the virus to the barest minimum. But it is almost impossible to say that because you've put measures in place, you are going to more or less wipe out transmission. In the early days of an outbreak, you can do what we refer to as suppression, where you can virtually push transmission below 1 to 0, and then the outbreak vanishes. But it is not all the time that you succeed in doing suppression when you've had some level of community spread. Especially in the absence of a vaccine, it becomes more difficult. And what we can do now is to make sure that we keep the transmission rate to the barest minimum. If 1,000 have it, you don't want 1,000 new cases when the first 1,000 recover. You want at least 500 when the 1,000 recover, and over time you can get it out of the population.
One of the things that we've noticed over the period has been the emphasis on the fatalities in relation to what the infection rates are. It looks like that seems to be the refrain when it comes to the briefings we seem to get weekly. And indeed, we get 2 of them every week.
Yeah. Well, you mean the numbers with fatalities?
Yes, especially that. So we seem to be taking some solace in the fact that, well, we've just had up to date just a little over 100, and I believe the case count today for fatalities are 129 as we're having this interaction. And it seems to be what government seems to be having some solace in.
Well, I mean, to say we're having solace in fatalities, I think it's quite weird or crude. I don't think...
Well, perhaps in comparison to other countries, I mean.
No, you know, every death is regrettable. Even when a 120-year-old man or woman dies, there are people who cry because you wish you could have people forever. But the point I want to make is that in as much as every single death counts, you really cannot have good appreciation of your situation when you only look at death in exclusive nominal terms. What I mean is that if you say, wow, I've had 200 deaths from COVID, and so my situation is so bad, the next question I'll ask is that, could you have done things in a way that would have made the deaths maybe 50? I can push you and say that, okay, you could have made it 20. But I can look next door, another country, and see whether with their best efforts, they're able to keep deaths in the tens or single digits. And so when you take a look at a country like South Africa, they have done about 3,310 deaths in SC now. Egypt has about, the number of deaths in Egypt, we're looking at 3,422. Mali had about 109. Nigeria has recorded 654 deaths. Now, the point I'm making is that once the virus can be fatal in some people, it's good to make sure that you avoid deaths. But at the same time, you must also be careful not to say that your system has come to a halt or has failed because you've recorded deaths. In fact, absolute numbers don't give much information. It is the percentages. And when you look at our mortality rate from day one, it's always hovered between 0.5 to 0.7%. The last time I calculated some few hours ago, we were doing about 0.7%. Now, what it means is that for every 1,000 cases of COVID-19, we lose about 6 to 7 people. Now, when you look just next door to a country like, let's say, Togo, the last time I checked, Togo was doing about 3%. Nigeria was doing about 2.5%. As for the US and Italy, we don't want to go there because they are doing 13, 14. So the point we are making is that this is a virus that can kill or result in fatality. That is why all of us must take it serious. Later, I mentioned to you, I'll come to the positive or encouraging aspect of COVID, the good news or the inspiring aspect of COVID. I'll mention that. But for now, my issue is very simple. COVID can be fatal in some people. We never know who that person will be. And so everybody should take the protocol seriously.
Well, we do know that. And I'll just take you straight away. There's an article that was published 6 hours ago on the BBC, and it's just captioned coronavirus, how fast is it spreading in Africa? And it's a question. And if you fast forward, you read before they get on to the graphical aspect of how the spread is. I'll read this to you, Dr. Okoe Boye. While it took nearly 100 days for Africa to reach an initial 100,000 cases, it took only 18 days for that to double to 200,000. It doubled again to 400,000 cases over the next 20 days. We're in trouble. Because if you look at the Ghana situation, even though it's not a replica of what's happening in Africa, you take the situation from the early part of March 12, when the announcement was made. We've now hit the numbers that we thought we wouldn't reach.
Yeah, I remember saying in the early days that you should be careful not to judge a country by the number of cases or deaths they have now. You have to look at what they could have had in the absence of interventions. So, if you take a country like the UK, they've lost 156,000 people through COVID-related deaths, 156,000. It's not like the UK went to sleep or is still sleeping. It's not like they are not having investments into testing, trying to isolate people, trying to do education. No, they are doing a lot of things. But in the midst of all their programs, they've still lost 156,000. It is possible if the UK had gone status quo, no intervention, maybe they would have lost 2-3 million people. How many deaths? Egypt has done 3,422 deaths. 3,000 plus people in Egypt. And I'm mentioning these countries because their economic strength is not that wide from us. Egypt has lost over 3,000 citizens. If you just jump and say Egypt is a failure or is a mess, you might be unfair to them. It's possible that if they are not put their COVID interventions in place, they could have lost maybe 15,000 people. As we speak, Israel has lost close to 380 men and women, citizens I mean. Roland, Israel and Switzerland are one of the countries that are very conscientious. They are cited by many articles as very strong in preventive medicine or public health interventions. Even they who are models, their deaths are rising. This tells you that your interventions are not an assurance that nothing will happen in your country. It would reduce the extent to which the deaths would have happened if nothing had been done. And that's why I always say that we should be careful. Otherwise, we would undermine and not recognize the efforts of health workers, government. Roland, you know, as we speak today, our airports are closed. The single biggest source of the virus is entry from other countries. If our airport, how do we call it, about 5,000 active cases. The next question is that how many active cases would Ghana have had if our airports were still open? If as a country we were not doing the testing in the numbers we're having now.
Is it also gainsaying that the interventions that we could have undertaken in a more sustained or a longer period, we decided to relax those interventions? The lockdown, just after 3 weeks, we decided to open up, and then also the related restrictions, interventions, we also decided to relax them. We're having an open period of registration, and all these creating the anxiety and the trepidation among the population.
Yeah, Roland, you know, I think before I go to the reopening of the lockdown and the easing, let me quickly say that if you look at the number of cases Ghana has, confirmed cases, 21,077. Please, in the 21,077 are all the 16,000 people who have recovered. They are part of the 21,000 cases. So I insist that looking at the confirmed cases doesn't tell you the story. In fact, you don't see much from the confirmed cases. It's the active cases that tells you the burden of the disease as we speak. Roland, reopening.
We actually have 21,968 just by today's count.
All right.
But very close to your number, yes.
Roland, reopening. All the scientists know, all of us are aware, that should the whole country and the whole world be indoors, the risk of having a rise will be lower. The virus cannot spread that much. This is a basic fact. We know about the virus. Stay indoors. But if you have a virus that is in a global population, and the curve shows that in the absence of a vaccine, it will be around for at least 3, 4, 5 years. The next question is that, do we stay indoors for 5 years? So nobody should make the mistake. Every country that eased restrictions is aware that easing of restrictions come with a greater risk than being indoors. But it's because there are other risks which might be bigger than the virus should you stay indoors for a protracted period.
So you're telling me there's always an opportunity cost for...
Absolutely.
And we were well aware.
Every country. In fact, that is why every country that has eased restrictions did it in a graduated manner, to see whether the ramifications can be handled or it will be overwhelming.
What we did, is that a graduated manner of easing restrictions?
No, but Roland, our kids are still at home. My kids are at home, but the final year students are at school. I visited Tertiary Presby Secondary School today. Final years are in school. SHS 1 are not in school. Why are they not in school? It is all being faced. As we speak, we allow some level of evacuations and all that of citizens or people who have to do essential work here. Our borders are closed. We will get there where the graduation will go. So the point I'm making is that every country that is restrictions is aware of the signs that letting people move comes with a greater risk. But it's because when you stay indoors, other risks start to mount. And I'll list one. I'll list some of them. The first one that was recognized in the US was that out of hospital deaths, those who die at home increased by 6 times in the US during their days of strict lockdown. People who would have come to the emergency with a heart attack or with chest pain died at home and were brought in as BID, or referred to as brought in dead in the medical parlance. Over-the-counter medications for anxiety went up by over 34% in the US. Depression cases, mental health cases started going up. Then they realized that there is a bigger problem. In fact, most of the people who called for easing or restriction were saying that they are dying from their economic situation. And Roland, sometimes I've heard media men who say that, why do you want to put economy ahead of lives? And if you've been monitoring my presentations, I always say that there is nothing like economy over life. It is actually life over life.
And so you're saying that the subject matter of what the opportunity cost was to look at, well, how far or plus or minus what we could get or not get, whether we kept the economy running.
But Roland, why are we doing contact...
You do know that the secondary schools were recording cases.
Oh, I'll come there, Roland. Why are we doing contact tracing? Why are we getting beds for the sick? Why are we investing in isolation centers and all that? We don't want people to die. In fact, we don't want you to get a virus. But should you get it, we have to make sure you're alive. So the bottom line is that all this activity is to make sure that people are alive and well. Now, there are other things that can take away lives, that kill people. So if maternal mortality can kill thousands of our women every year, and road traffic accidents will kill 7,000 Ghanaians annually, and the virus can kill, let's say, 500 a year, if all your investments go into the virus, and already with your limited or some investment in road safety, you are losing 7,000 a year. It is possible that you start to lose 14,000. So is it worth, or how do I put it? What do you really want? To avoid 10 deaths in COVID and have 1,000 deaths in road traffic accidents. Every death is important and should be avoided. And that is why I'm making the case that the one who is the health manager, when I sit at this table, I cannot afford to look through Ghana's situation with only a COVID lens. I must be interested in the risk in the population. And Roland, I tell you, anytime you step out of your house to go to multimedia, there is a risk of death from driving on our roads. 7,000 annually. How do you reduce your risk? You put on your seatbelt. You look over your shoulder. You look through your side mirrors, and usually you try to avoid overspeeding. These are what we refer to as risk reduction behavior or measures. Once the virus is in a global population and we don't have a vaccine, what you have to do when you step out is to engage in risk reduction. I'm wearing my mask. You are also wearing your mask. We've kept some distance apart. It's because our risk of getting a virus now is higher than if I'd stayed at home today and not come to Ministry of Health. Roland, your risk of getting COVID-19 is greater if you step in multimedia than if you stay in
I do understand that. And then making an average of just a little over 2,000 fatalities for accidents is good. And then progressively saying that there are other fatalities that are recorded due to some ailments that are also within the public health system. I do understand that. But for us knowing we have hindsight and still reducing the restrictions, allowing students to go to school, and ultimately still recording cases while there is excessive anxiety on the part of the public parent, etc. That means we're just compounding the problem within the public health system.
Yeah, you know, we can drive our anxieties up if we want to, and we can drive them down if we wish to have them down. I've been a little bit worried by some commentators who speak in an alarmist fashion. This is a pandemic that has affected the whole world. And in fact, the last time I met one ambassador, I wouldn't mention the name, she told me that she's been here with her family since COVID broke out, and she's never felt like going back to her country because her safety and security and state of mind is just as it would have been if she had been in a country. This is a country that has provided facilities for taking care of those who fall sick, that provides opportunity for testing for those who have become contacts. This is a country that has invested in providing face masks to over 1 million people at the SHS level. We supplied over 3 million masks. We are doing all this to make sure that we have a population that is protected, their risk reduced. Roland, in Ghana now, when we talk about prevalence of a disease condition, we mean that when you take 100 people or you take 1,000 people, you can pick some number who have the disease. Now, the virus is in the global population, in Ghana's population. What it means is that if the rate is about 2%, it means if you pick 100 people from Teshi, La Scala market, you can pick 2 COVID cases. If you pick people from Suhum, 100, you can pick 2 positive cases. If you pick 100 people from Ministry of Health, you can pick 2 COVID cases. From multimedia, you can pick 2 cases. Now, it is because we assume that there are positive cases or people who might have the virus in the global population, in the Ghana's population. That is why you are wearing mask, and I'm also wearing a mask. It's not for fashion. It's because we assume that the person next door might be positive. So you do all these protocols because of the assumption. But if through a test it is established that someone is actually positive and not presumed to be positive, the fellow goes through the motions, which is isolating the person, treating the person until the fellow recovers, and then you let the fellow go. We should never get into the trap of saying that because one positive case was detected at multimedia should shut down. Because the Ghana Army recorded 1 case in Burma camp, the army should shut down. Because the mosque recorded, all mosques should shut down. Otherwise, the whole world must shut down. Because anywhere you test people, Roland, don't be surprised. Forgive me, someone quoted me that said it's no news to get a positive case. Are we surprised if you test students at less infantile and get 1 positive case? Why are you surprised? The virus is in the global, is in the world population, is in the Ghanaian population. That is why all of us must take good care of ourselves, so that the one who has it will recover without giving it to you, and then the virus can be pushed out.
There's a considerable aspect about how equipped or not those who are the front line are. And we'll talk about the testing issues. But there are constant complaints, and indeed over the last 7 days we've been interacting with members of the Ghana Medical Association, nurses, and they constantly are complaining that they just don't have enough of the PPEs.
Yeah, Roland, so personal protective equipment. Some of them are actually reusable, like a face shield. If you have a face shield, all you have to do is to disinfect it, and you can use it for some time. But we have what we call surgical masks, which are used and disposed for. You can use it daily, or sometimes in half a day. We have gloves, which are also used and disposed. You dispose of them. Now, Roland, because PPEs happen to be one-time use materials, no matter the stock levels that you are giving, if we don't monitor the levels to do restocking, there will be inadequate levels over time. And so what I always say is that as a government, we are committed to keeping the supply chain going. Keeping the supply chain going means that if we give you 5,000 copies of the mask and it drops to 2,000, we must be aware that the levels are dropping. There are some claims or calls for supply with the how do you call it, argument that there's been shortages. I have heard of some of those complaints. Some actually, when you go into them, deserve attention. There are others also that when you go into or try to investigate, you realize that are actually...
You are saying the hospital administrators, your nurses, your doctors are not truthful to us?
I think I just said that there are some claims.
Because you're saying there are some claims that are made, which, if further investigated or scrutinized, may not necessarily be the case.
Yeah, I'll give you one example. In fact, two. One from Director General Abuaji, one is shared with me, and that one that I had a personal experience with. The first one, like I said, is that I started by saying the caveat, or the, what's the word? The prelude is that there are some claims of inadequate levels of PPEs, which when you go into are ones that deserve attention, meaning that you really must support or supply to keep adequate levels. There are some too that usually are unfunded when you go into them. And one example I'll give is that I got a call from a friend who told me one Saturday morning that they've had non-availability of PPEs in one of the big hospitals in Kumasi, and that because of the non-availability of the PPEs, they are even refusing to take care of the relative. I had to quickly call the facility head. And Roland, the facility head told me that we have PPEs. Give me the name of the patient. I went back to the person who called me, and now the person doesn't want to give me the name. You know, so, and the doctor told me that we just gave them all they need. In fact, this person mentioned a particular PPE item, which was in shortage. When I called the head, he said, we've given them, just mention the place. So the point I'm making is that we can't sit here and say that nobody really had inadequate levels of PPEs. What we encourage facilities to do is to share with us the levels of PPE so that when it's going down, we can intervene. And I'm happy to say that just this afternoon, about 3 hours ago, we met the Ghana Medical Association, the ministry met the Ghana Medical Association, the Ghana Health Services Director General was sitting, the Chief Director was in. What we've decided to do, and the letters will go out very soon with the blessing of my boss, Honorable Minister Okoe Boye. What the minister wants to do is to help us set up what we refer to as logistics management committees at the district level.
And that will help resolve some of these difficulties?
Absolutely, because most of them has to do with monitoring. Because you have instances where you can go to the regional stores and you have, let's say, 20,000 N95 masks, and then you step into a regional hospital, and those in the hospital are saying, we don't have N95 masks, we need masks. So
it's basically just decentralizing the process of the logistical movement.
No. You see, monitoring is so key, because monitoring will tell you whether it's a matter of non-availability, a matter of distribution, a matter of hoarding, a matter of inefficient, logistical management. It's the monitoring that will tell you what is happening. And this time, we are going to make some of the key stakeholders be part of the LMC. We are going to have the municipal health director for each district, or the district director of health. We are going to have the facility head. Let's say if you take Lekma as a district, you are going to have the municipal health director for Lekma on this logistics management committee. You are going to have the facility head for the biggest.
Why don't you involve the clinicians themselves beyond just the administrators?
Today you've been quite impatient. I would have added them. So if you just so we are going to have the health director, the municipal health director. We You are going to have the head of Lekma Hospital, which is the biggest service provider. You are going to have the stores keeper, the stores manager for the district. Then you have a rep of Ghana Medical Association, a rep of Ghana Registered Nurses Association, and Ghana Laboratory Medical Sciences Association, 6 of them. So now you have all the stakeholders getting an assessment of what is on the ground and bringing us reports. This would help to keep the chain going, monitored, and then restocked.
The last week, we had interaction with the Ghana Health Service. Yeah. Indeed, during the briefing, it was said that we have shortage of reagents in some of the top labs that we have, and Noguchi is the most notable one. We interacted with officials of Noguchi, and they corroborated the concerns that had been raised by a number of the personnel. Have they now been restocked?
Yeah, Roland, before I even come to this, let me say that the flight arrived Saturday with reagents and most of the pipettes, all the things that are used in the testing chain. So we are on safe grounds now. But you see, that's why the meeting with GMA was very good. And we are going to communicate similar meetings with Ghana Association of Medical Laboratory Scientists and the nurses as well. Roland, because the whole world is testing for COVID, and you have limited companies that are into supply of the reagents, the chemicals you need to do the test. When you go to those companies, you have a queue. So we've had instances where you have the money, but you have to wait for weeks before you get the reagents. You can look at the population.
Is it not because we didn't think that our case counts up to date to be where it is currently?
Oh, Roland, I know you don't only watch JoyNews. I know you watch other channels. If you turn on the news, in the US, there are complaints of waiting for reagents.
I know about what you're saying, but the point is that we may have done some regression analysis and gotten some indication as to where our case count will be 2 months, 3 months, 4 months, 5 months down the lane.
Roland, the point is that when you are dealing with an epidemic or a pandemic that is dynamic, no matter how good your modeling is, all your assumptions cannot be right. And so, as a country, we must be in the position to live up to the challenge anytime it emerges in managing a pandemic.
And we had to wait till we get shortages.
The point I'm making is that if Ghana had been the only country with a shortage, I would understand, or how do you call it, I appreciate what they're saying. But Roland, the materials for testing are not like bottled water that every country can produce in numbers that they wish in their own comfort zone. You are going to about 2 or 3 companies in the whole world who have to deal with a global population of about 2 or 3 billion, Roland. Obviously, you are going to have challenges. And so some of the challenges we've had are structural challenges which have been occasioned as a result of what the whole world is dealing with. When you have money and you want an item, and you've been told that because US is in the queue, Turkey is in the queue, China is in the... Remember, ours arrived Saturday. There are other countries that are waiting for their reagents. It's because the whole world is going to the same fuel source. And if you've done some basic economics, when the demand far overwhelms the supply, there are many things that start happening. Either you're going to have shortages, you're going to have price hikes, you're going to have all kinds of scenarios. And I'm happy that at least we've gotten the chemicals and the equipment that we need to quickly restore our testing levels. That is absolutely important. And Roland, because you mentioned Ghana and deaths and all that, I've seen some article, I've seen some people trying to fly things on social media that Ghana is accounting or is part of the countries accounting for the high cases in Africa. And when you read, you realize quickly that there is a lot of, I don't know the word to use, but misinformation over there.
You mean the number of cases? No, we're not.
Yeah, let me.
But if we take the case counts, though, you look at what the numbers are. We're in the region somewhere.
Yeah, Roland. So this is what they did. They just looked at the top 3 or 4 countries in Africa with the highest number of confirmed cases. And of course, when you look at Ghana, our 21,000 total confirmed cases. you can say that it's...
So this is what we have. Confirmed cases of COVID have spread, and how they have spread in Africa. So we do have South Africa in excess of over 196,000, Egypt following Nigeria and Ghana. So we're fourth.
It's good. And you see...
It's not good.
Yeah, Roland. So this is what...
What's helping us is the fatalities, not per 1,000 population, not in the regions. I'm
happy you've mentioned the fatalities.
No, we all do acknowledge that.
Yeah. You know why? Most countries in Africa, in fact, apart from South Africa, most of the countries in Africa, their testing regime is very poor. Roland, when I say poor, they are either not doing the test at all, or they are doing very scanty tests.
Meaning, if they were doing more tests, they would have recorded.
Roland, but how do you confirm a case if you don't test it? Most of the cases we had, if you are not being tested.
Well, the concern is that the government is giving itself credit, saying that because we're testing, that's when we're getting more cases. Whilst in reality, it's also spreading through the communities, even to the point where we have top leadership in government who are even getting infected because of these interactions they're having with the communities.
Roland, by the way, Nigeria, per million population, for every million Nigerians, they do 742 tests. For every 1 million Nigerians, their government tests 742 people. For every 1 million Ghanaians, this government tests about 9,000 of them. You know what it means? If Nigeria tells you they have 30,000 cases today, with their 742 per million, it means if they should dare test even 7,042, which is 10 times this, they are going to have 3 times 10, which is 300,000. So what it tells you is that Nigeria's graph or picture cannot be close to reality like ours. It means once Nigeria increases their testing regime, you should be expecting cases. And that is why you see their fatalities, it will be more. So you take a country like Togo. Togo, their cases is low because, of course, their testing regime is not like Ghana. But when you go and check fatalities, the fatalities do the exposure. Because if you test more, then your fatality or mortality would be lower. Egypt is doing, 1,319. Egypt. So Egypt's cases that you see over there, if Egypt should dare test like Ghana, their case should multiply by at least 5 or 6 times. No wonder Ghana would be mentioned as one of the countries with a high number of confirmed cases. Because, of course, if you are testing 9,000, and South Africa, by the way, is testing 31,000. That is why they are huge, their numbers are huge. So their graph is real. All other graphs in Africa, almost all other graphs, are far away from reality. Apart from Ghana, South Africa, the rest, and Nigeria is doing 740, like I always say. In fact, when I check, Mali is doing 806. And Mali has recorded 119 deaths. So, Roland.
So we're taking solace in that?
It's not even solace. When you test more, you can pick cases early. You can watch them closely and intervene so they don't die. Those who are not testing much end up having the cases. Remember, I will not mention a country. There was a country that said they were having mysterious deaths. Even for deaths, if you don't test, you didn't know. Only for them to...
You are even a member of parliament. So let's look. We found a number of cases. Accra Girls Senior High School, 6 cases of COVID. Parents agitated, forcibly entering the compound of the school, and they want to take their children home.
But when you go home, the virus is in... The virus can be, if you stay at Teshi, the virus can be in Teshi. If you are done sober, the virus can be there. So where are you going? The virus is in the world's population. All you have to do is to ensure that you obey and go by the...
So you're saying that we knew that, well, we want the children to go back to school or the pupils to go back to school, yet we knew there would be some cases.
Look...
You're saying it's inevitable.
No, you know, for those who were shocked when some cases were recorded at multimedia, I laughed when I heard that people were shocked. Anywhere in Ghana, if you test people, you can pick a positive case. That is why anywhere you find yourself, you must take care of yourself. And by the way, and this point is very important, COVID is not like cholera. When there are 100 cases of cholera, all the 100 are sick, might be vomiting and running. But when there are 100 cases of COVID, about 93% of them, or 94, are like yourself and myself. And so the point is that hundreds of cases, when mentioned, does not equate to morbidity or being ill. And that is why you must take care of yourself. The positive cases you might hear in Accra Girls should you go and do testing at Medina Market, you can pick a positive test there. The assumption is that anywhere you find yourself, there can be a positive case. And that is why you must take care of yourself. I'm happy that the girls who were picked at Accra Girls, I learned almost all of them, the report I got, are either having mild or virtually no symptoms. Now, this reminds us that it's not everybody who is sick and needs admission. Take care of yourself, because the next person next door might be COVID positive. Very, very important.
As we wind up the conversation, we do know about the policy based on what the utterance of the World Health Organization has been. And so we decided to be categorizing our recoveries in relation to the discharges. But we also do know that there's been some level of dispute that for even asymptomatic cases, they could have some level of infections as they go by, progressively.
Roland, so in managing a disease, almost everything we do is based on studies that have been done. So you are wearing this mask, I'm wearing a mask, because they did some studies and realized that the virus can pass through the air, through droplets. So we are wearing a mask. We use a sanitizer because studies have shown that chemicals, alcohol can denature the virus, meaning can make it inactive. Roland, it was studies that showed us that even when someone is positive for COVID today, even 4 weeks down the line, they can still be positive. And so the WHO said, wait until the first person has tested positive before you let them go out of isolation. Then they realized that even for some who test negative, they come back to test positive again. So the WHO said, please do 2 negative tests before you let go. Then smart scientists sat down and said, wait a minute, there's a positive test, mean that the fellow is having the virus or is just having remnants of the virus. How do you tell that someone is having the virus? We do an experiment they called isolating and growing the culture. So these people isolated the samples in those who have had COVID for less than 1 week. And realized that when you culture, the virus multiplies. But for all those who have had the virus and have been well for 11 or more days, when you culture, no virus. Yet, their PCR test was positive. So what was the conclusion? A positive test after 11 days means that you have remnants of the virus. You have
meaning what? It's only the load that's reduced.
When you do a PCR test, what the test does is to pick a segment of the virus. So if like it's Dr. Okoe Boye, it will be looking for parts of my body because it knows how the parts look like. So when it picks my arm, it says that yes, this is Okoe Boye's arm. But the one who is doing culture is not looking for your arm or your leg. It's looking for the whole human being to see whether I can multiply. So it was the culture experiment that showed that, wait a minute, all this while, if you are not careful, you can keep someone in isolation for 1 year when they are active and strong, because you still can be picking debris or parts of the virus when actually they are free of the virus itself. And so the lesson is very simple. After 14 days, even should you test positive for the virus, what is in you is not the virus that can shed or go to another person. You are not infectious and you can be allowed to go back into the population.
And you're not a danger to anybody at all.
Absolutely. It is the science that made us stick to the first protocol. The same science we trusted in the light of better evidence and knowledge is telling us that this is the way to go. And as we speak, in Dubai, they've changed their protocols. In fact, they are not even doing 14 days. I think they are doing about 11 days. When you go to Singapore, they've also changed their protocols. When you go to China, they've changed their protocols. Remember, this holds for people who have no symptoms. And in Ghana here, 97 to 98% of all our COVID cases are either in mild or asymptomatic condition. It means they've qualified for the first criteria already. They are waiting for the 14 days, and then off they go. No wonder close to 75, 76% of all our cases have recovered. That is the brighter side or the hopeful story about COVID, Roland. Many cases can be reported, but by the grace of God, many more recover. But since one or some can die, and we don't know who that person would be, it's worth taking care of yourself.
And so the key question then is whether asymptomatics can't spread the virus.
Roland, if you are asymptomatic, but you've had the virus for only the first 5 days, you can spread the virus.
Okay. So I'll quote a World Health Organization expert, and Dr. Maria van Kerkhove, and I'm sure that this has been quoted to you over time. And there was a simple question that was asked her. Initially, she said, it's not possible. And she said, we don't actually have that answer yet. And continued, it's possible, 40% could still spread.
You know, one thing, when you hear a scientist speak, Roland, we don't speak in absolute terms. We say science never says never. Although we've had studies done in Singapore, we've had publications made by the Academy of Sciences in Singapore that after 14 days, someone who is even positive for the virus cannot shed or infect anybody. Roland, you can pick 1,000 people and you can have one person who breaks the norm. So when you see a scientist speaking, let the science in me speak now, not a politician. The science will tell you that in as much as I have cited and read this article, I do not speak in absolute terms and pretend that this information I have will remain so until Christ comes. So in conclusion, Roland, let me quickly say that there is absolutely no need to fear or to be scared or to panic. The control you can exercise when it comes to wearing your face mask and observing distance and washing your hands should be what attracts your interest. Take care of your situation. The government will also make sure that we create a safer environment. And at the end of the day, the virus would leave. But you and I are supposed to stay behind. No one should live with the virus.
Well, thank you very much. And we've been speaking to Deputy Minister of Health, also Member of Parliament for Lejokuku, Dr. Okoe Boye, helping us clarify a number of issues related to COVID-19 and how well, as a country, we're managing that. But that way for our discussion for now. We go back to the studio.